understanding arthritis causes, symptoms, and how to take control. If you've ever experienced lingering joint pain or stiffness, you might have wondered, is this arthritis? You're not alone. Arthritis is one of the most common chronic health conditions in the world, affecting more than 50 million adults in the United States alone, according to Penn Medicine. It doesn't just touch older adults, either people of all ages, including children, can develop arthritis. Despite how widespread it is, arthritis is often misunderstood. It's not a single disease, but rather an umbrella term for more than 150 different conditions that involve inflammation in the joints. From everyday wear and tear to complex autoimmune issues, the causes of arthritis are as varied as the people it affects. In this article, we'll break down what arthritis is, explore its many forms, and take a look at how to manage symptoms so you can lead a more comfortable, active life even with arthritis. What exactly is arthritis? It means joint inflammation, but in practical terms, it's a condition that causes pain, swelling, stiffness, and reduced range of motion in one or more joints. It can affect nearly any part of the body, though it most commonly shows up in the hands, knees, hips, feet, lower back, shoulders, and ankles. You may notice discomfort that starts small, like a little stiffness when you wake up in the morning, but over time, it can progress to more persistent pain that interferes with daily tasks such as walking, dressing, or typing. Types of arthritis. More than just one disease, there are over 150 types of arthritis, and each type has its own triggers, symptoms, and treatment approaches. However, a few of the most common forms include 1. Osteoarthritis OA, often referred to as wear and tear arthritis. Osteoarthritis is the most common form and usually develops as we age. The ends of bones gradually breaks down, leading to pain, stiffness, and loss of flexibility. Osteoarthritis typically affects weight-bearing joints like the knees, hips, and spine. 2. Rheumatoid arthritis RA is an autoimmune disease, meaning the body's immune system mistakenly attacks its own joints. This causes chronic inflammation that can lead to joint damage and deformity over time. Unlike osteoarthritis, rheumatoid arthritis can also affect organs and systems beyond the joints. 3. Ankylosing spondylitis form of arthritis primarily targets the spine, causing inflammation that can eventually lead to the fusion of vertebrae. It typically begins in early adulthood and can result in a hunched posture if not managed. Other types include psoriatic arthritis, gout, lupus-related arthritis, and juvenile idiopathic arthritis, each with its own unique features and challenges. Causes for arthritis symptoms vary depending on the type, but here are the most common red flags: joint pain and tenderness, swelling around joint stiffness, especially in the morning or after. Periods of inactivity, reduced range of motion, warmth or redness around a joint. In inflammatory types like rheumatoid arthritis, you may also experience fatigue, low-grade fever, weight loss, or general malaise. If you're noticing any of these signs, especially if they persist or worsen, it's time to speak with a healthcare provider. Early diagnosis and treatment can make a big difference. What causes arthritis? There's no one-size-fits-all answer when it comes to what causes arthritis. Some people are born with a genetic predisposition, while others develop arthritis as a result of lifestyle or health conditions. Here are some common causes and risk factors. Age. As we age, the risk of developing arthritis, particularly osteoarthritis, increases. Genetics. A family history of arthritis can increase your likelihood of getting it. Injury. Past joint injuries such as sports injuries or fractures can raise your risk. Overweight puts more stress on joints, especially the knees and hips. Autoimmune disorders. In RA and similar conditions, the immune system goes into overdrive and attacks healthy tissue. Infections. Some types of arthritis can be triggered by bacterial or viral infections. Occupation. Jobs that involve repetitive joint motion or heavy lifting can increase arthritis risk. Managing arthritis. What you can do while there's no definitive cure for most forms of arthritis. The good news is that symptoms can be managed effectively through a combination of medical treatment, physical care, and lifestyle adjustments. 1. Medications. Doctors may prescribe medications depending on the type and severity of your arthritis. Pain relievers like acetaminophen or NSAIDs, e.g. ibuprofen, for symptom relief. Corticosteroids to reduce inflammation. Disease-modifying anti-rheumatic drugs, DMARDs, for autoimmune arthritis. Biologics, a newer class of drugs, target specific parts of the immune system. 2. Working with a physical therapist can help you improve joint flexibility, strengthen surrounding muscles, and reduce strain. Tailored exercises can go a long way toward improving function and reducing pain. 3. Assistive devices, braces, orthotic shoes, canes, or ergonomic tools can ease pressure on joints and help you move more comfortably throughout the day. 4. Lifestyle changes. According to the Mayo Clinic, many people with arthritis find relief through simple but powerful lifestyle habits. Maintain a healthy weight to reduce joint stress. Exercise regularly with low-impact activities like swimming, walking, or yoga. Apply heat or cold to reduce pain and stiffness. Eat an anti-inflammatory diet rich in fruits, vegetables, whole grains, and omega-3 seconds. Quit smoking, as it can worsen arthritis and hinder treatment. Living well with arthritis, it's understandable to feel discouraged if you've been diagnosed with arthritis. But know this: arthritis doesn't have to define your life. With treatment, support, and daily care, you can still pursue your goals and stay active. Resources that remind us that chronic inflammation, if left unchecked, can lead to long-term tissue damage. That's why early intervention and continuous care are so crucial. Whether you're newly diagnosed or have been living with arthritis for years, remember, knowledge is power. Understanding your condition and how to manage it is the first step toward regaining control of your health. In summary, arthritis is a complex condition that comes in many forms, but it's not unbeatable. From understanding your specific type of arthritis to adopting lifestyle changes and working with healthcare providers, there are many tools to help you live more comfortably. So stay informed, stay active, and take charge of your joint health, because movement, after all, is life.